Hi, good morning. This is Andrew Lau, the Shuti president. Hope everything's well with you guys. Well, one of the things that today is a really very good webinar. The reason is because we're going to talk about sleep apnea and how it related to high blood pressure. And what is the really, when you combine the two, is a truly a dangerous pair for anybody who have apnea and high blood pressure, and also who relate to diabetes. And really, at the end of the day, this is something that a lot of people don't aware of, but it will be good to now find out and do something about it. Because if you don't, sleep apnea can be continued bad, and eventually, you know what could happen? You might end up with stroke, heart attack, and really become a very detrimental health issue for anybody. Okay, so I'm going to start putting my screen out for the lectures, so that way we can start going to talk about.
There's some issue with the line.
Okay.
Your line has stopped.
Okay. So hold on. I have to set up the live for the Facebook people. So let's try that one more time. So live stream people.
You can now do it.
Okay, it works?
Yes.
Okay, good. All right. Anyway, sorry, there's some technical issue we just want to resolve. Make sure that we're on live on Facebook, and because there's quite a people actually also see me on Facebook. So okay, so now we're going to start our program, and we'll go from there. Okay, so but today's webinar is a really important webinar because of the fact that this is a webinar that will help you to better understand why this is so important to have, check out your sleep apnea and how that relates to your blood pressure, and you preventing all that potential issue for you. And that's really, I think that's why this is a good webinar for everybody to understand. Okay. All right, good. So anyway, I know today there are a lot of people come from different part of the world, and I'm so happy to actually work with many of you, but it's good that we now start to have a program that you can able to understand what is sleep apnea related high blood pressure, and why you have to look into it. Okay, so we'll start the lecture now. Okay, what we'll talk about is first, the subject of apnea. So we want to understand what sleep apnea mean. What's that? How that related to you, and you have to also understand what is high blood pressure. And again, this is how that relate to you, and the link between the two conditions and the risk of health impact if you really have sleep apnea, and then eventually you got high blood pressure, and how you diagnose, how to treat, and how to prevent, and how those shooting can help you. And so we will go through that, and then eventually with the conclusion, and we'll have some time for Q&A. Now, I noticed today a lot of people I'm not familiar with, which is all right, but they came from all different places. Some of them is from the United States, some of them Canada, some of them from Hong Kong, Philippines, and all over South Asia. But that's all right. But what we're going to do is first, we want you to catch up with everybody, make sure everybody understand how pre-diabetic, diabetic form. Now, everybody, if they become a diabetes, they will actually go through 4 stages. The first stage is LDL cholesterol start increasing. Now, no kidding. I have so many customers come in and say my LDL cholesterol goes up and my blood sugar eventually went up. And they went through the same thing. And I have so many experience now. It's really, when the LDL cholesterol goes up, you better go check your doctors. And eventually your blood sugar eventually goes up. Reason is the LDL cholesterol will damage the B cells, which is the cells come out from the insulin, from the pancreas, and what it does is it takes sugar to the cells. The B cell got damaged, it won't take sugar back to the cell, so you have no fuel. Blood sugar will continue goes up and up and up in the bloodstream, and the LDL cholesterol and blood sugar mix together, the blood becomes thick, and net result, that's your problem's going to form, because it's going to form plaques everywhere. So people very quickly move to stage 2, which is blood pressure start going up. The reason is all these plaques is going to plaque forming clots on all your arteries and everywhere, and so you get less space, so your blood pressure will start going up. That becomes stage 2. Now, all these you might know, no feeling, no pain, nothing. There's no sign to tell you that's happening. And then eventually, very quickly, you move down to stage 3 because your blood sugar continue goes up, and then you will start maybe you're going to see a doctor, and then they eventually start identify, hey, you're going to have so-called pre-diabetic. How to measure pre-diabetic? Every doctor measure the same. They measure how much sugar attached to your hemoglobin. Everybody will have this protein called hemoglobin in red cells, and how many percent sugar. Now, you're 5.7 and below, you're a normal person. If you're 5.7 to 6.4, you are a pre-diabetic. Unfortunately, pre-diabetic, you have no medication. The doctors say, hey, you're pre-diabetic, you have to change your lifestyle, exercise, lower your weight, control your diet with low carbs, and that's what you need to do. Unfortunately, because you don't know anything, you really have no motivation to do that. So my people just sort of keep up the same lifestyle. Now, one thing good here is we could help you here, because if you have pre-diabetic, if you drink low sugar tea, it will definitely help you to lower your blood sugar, and then also lower your LDL cholesterol. So net result, you can continue to stay the range of pre-diabetic or go back to normal range. If you became diabetes, they can also lower your A1C from high 10 and above, come back down to lower than 6.4. Now, if you don't do anything, 2 to 3 years, most likely you will switch to diabetes, which is over 6.4. Your A1C over 6.4, you become a diabetic. Now, when you become a diabetic, unfortunately, you are not able to do much, except you have to have medication, and blood sugar will continue to go up. You've got to control, because if you don't, the major problem is the sugar and the cholesterol mixed together to form plaques everywhere. The whole body will start plucking up. It will damage your kidney, it will damage your heart, damage your eye. All kind of problem will exist later on. So you really need to take this seriously and do something about it. And that's why we try to educate everybody. Now, if you diabetes, you can't go back. Once you become a diabetic, you will not able to go back. It will continue to be diabetes. And only thing is you got to control, or what we talk about, your lifestyle and so forth. Hopefully you move all your blood sugar, your A1C down to below 6.4. If not, your insurance always goes up. You have all kinds of complication, and that will be terrible. And that's what we're trying to prevent for everybody. Now, why drink low sugar tea? Low sugar tea has only 2 things. It's not a drug. It's just a food. It's a food that has guanylate beads, which will delay the absorption of sugar into the blood vessels, the gut blood vessels. And then you have the bitter melon, which will help you to increase the insulin sensitivity, take back the sugar into the cells. Excess sugar and cholesterol will dump out from the urine, and also dump out salt from urine. And that result, when salt go down, your blood pressure will go down. So it'll go down, your 3 high will actually go down. Isn't that wonderful? Because if you lower your 3 high, mostly you'll be very healthy. Now, unfortunately, we don't just tell you that just drink low sugar tea, because we have a program. We have 300 somewhat 28 lecture in YouTube to help you to understand how to prevent a 3 high. What do you have to do? The disease process. We have all that for you. So first, we teach you how to drink low sugar tea, teach you how to do low carb diet, low fat diet, teach you how to exercise, and all these are in your YouTube. I'll teach you about weight control, so your BMI 30, how to get you down to 23. Where weekly webinar is totally free for you to learn about how to prevent diabetes. And then you have daily blood tracking. We have a system to show you how to track your blood glucose, and able to also help you to understand, wow, how are you doing so far? And plus, we have products that can help you with tracking your A1C, go down. If you can continue to drink low sugar tea, will help you to bring low sugar down from 10 plus all the way to 5.7. So that's what we'll do. We don't just give you to drink low sugar tea, okay? And that's important. You have to learn, because if you learn, that you know how to prevent it. So let's talk about what is sleep apnea. Now, sleep apnea is a really serious disorder, which what it characterizes basically somehow you stop breathing while you're sleeping. Well, how come that happen? Okay. Now, if you have sleep apnea, that one of the things that is caused by obstructive sleep apnea. In other words, something block your airway, which is very common for typical sleep apnea. And it happened that your tongue muscles, that area, it just relax and just cover your air pipe. And so you can't breathe. And then, you lack of oxygen and so forth. And that can cause all kind of problems as we go on. And the second type is central sleep apnea, meaning the type happen is your brain failed to send signal to the right muscle so you can respond to breathing. Now, that is also not as common, but there is this thing. And there's a mixed complex of sleep apnea, meaning they have two, which is the obstruction sleep apnea, OSA, and the central sleep apnea also there. So both have that, which is also have, but it's not as common. But the most common is OSA, obstruction apnea. Now, there's the figures here, which you can see, and you can see this is a person with the nose, right? Air coming in and air, and this is the tongue. Unfortunately, when you have apnea, the tongue somehow will just so relax and just cover the airway here, totally cover. And when they cover, air is not going down. So net result, you have that issue. But if a normal person, they will not do that. So your oxygen can go in as open airway air exchange. But when you have actual sleep apnea, this actually cover the airway, so air cannot come in. So you become a low oxygen and become actually make the heart really have some pump more and issue. And eventually, if you really do a lot of those, you might even have a stroke and heart attack. So that's why sleep apnea, a lot of people don't realize, is important things that you have to fix and make sure you have to be treated, okay? So the cycle of sleep apnea first is, so first of all, you have partial or complete obstructive sleep. You went deep sleep, okay? And when you deep sleep, the airways start relaxing, and then airway, the tongue or air, whatever, will start closing the airway because they relax, but also block the airway, and your blood oxygen will start failing, and the pump will go faster and faster because now you have no oxygen. The pump will say, hey, I don't have enough oxygen. I need to pump more to all the major organs. So that result, the heart will pump faster, and then your blood pressure will start going up because you can't get the O2, right? So the heart will work hard, and the blood pressure goes up, and then you sleep disrupted because you try to grasp air. You didn't know yet because you are still sleeping. Eventually, you move wherever you might get back to air, and the sleep will resume. And so this whole cycle go over and over again. The problem here is your continued lack of oxygen, and the heart pump faster, and the blood pressure goes up. And this is a problem that will cause you all kind of actual health issues as you move on if you don't get treated. And that's why this is so important. Now, some of the key symptoms of sleep apnea is actually you can be impotence, you can insomnia, you don't sleep well, sleep 2 hours, you wake up. You also loud snoring, and your wife gonna hate you, or your husband, your spouse gonna hate you. The reason is you have all these muscles here, and it's really have a narrow gap, so the snoring become louder and louder. You also have dry mouth, you have morning headache, you have also confusion memory because you can't sleep well, you have difficult breathing, you have mood swing, your weakness. Also at the end, you have also respiratory problem. At the end of the day, you will feel tired the whole day. You just falling asleep during the day. And that's a lot of people have key symptoms of sleep apnea. Where during the day at 3, 4 o'clock, they tend to get very tired and fall asleep. And that is not really, because at nighttime, you don't get very good sleep because of sleep apnea issue. Okay? So that's what happened. Now, the risk factor for sleep apnea. So you have sleep apnea, what kind of risk that you have? Major factor is stroke, because the air cannot go into your body. You lack of O2, blood O2 cannot get to the brain. You can have stroke, and that is a big risk. Now, certainly a lot of these people have usually excess weight. Where they got chubby neck here, they usually have a big tummy, and they usually excess weight. So the and the neck area, because they're so fat, really the airway become narrow. They also have potential narrow throat. Male usually 2 to 3 times like they have sleep apnea, 2 to 3 times. Where it's a big percentage. You might have lung problem, hormone disorder. Many of these people are older people, maybe 50 and above. They have high blood pressure, they have nasal congestion. There's also some of these people are substance use, they're smoking, drinking alcohol. Sometimes these people have family history. A lot of people don't realize type 2 diabetes, a lot of type 2 diabetes have sleep apnea. So you got to remember, type 2 diabetes, they do have, many of them have sleep apnea. So we learn about sleep apnea. So now let's go to what is high blood pressure then. Why this all related? Let's take a look at blood pressure first. So what is high blood pressure? Well, high blood pressure is a condition where the the vessels become very a lot of things blockage should be narrowing, so the blood pressure become high. So in other words, you have blood vessels here and the blood pump, and this elevated, that is called the systolic pressure. And when you remaining pressure is diastolic pressure. But what happened is when you move this up, systolic pressure, it took a lot of force to go up. And that become over 130 above. That's considered high blood pressure already. So if you go even 220, that's very high. So the remaining pressure is called diastolic pressure, and that should be 80 and below. But if you are over 90, you also have a high blood pressure issue already. So the important is you have to always think about your blood pressure should be 120 over 80, not 150 over 80. It's 120. The most you can get is 130 nowadays, and then the systolic should be no more than 90. So make sure you always try to get yourself to be 120 over 80. That's your blood pressure. Now, certainly, what caused high blood pressure? Certainly age, because what happens is almost of your arteries are no longer flexible anymore. So it took a lot of force to move your arteries, the blood up and come back down. And also the vessels are not as flexible, so the blood pressure are higher. So that become an issue. Age can be one of the major issues. Now, genetic, maybe your parents or family, they all have high blood pressure issue. That may be you at the end of the day, might also develop high blood pressure. Lifestyle factors is also very important. For example, you have very poor diet, you smoke, you're not really, you do a lot of smoking, and you drink a lot of alcohol, as your work is tremendously stressful. All that will affect your blood pressure. And some people have chronic condition and health, like, for example, sleep apnea, obesity, kidney disease, diabetes. All that will cause you potentially high blood pressure, as we mentioned earlier, right? You learn about why your blood pressure is high. Now, certain medication will also do that because, like, for example, you're taking contraceptive and also over-the-counter decongestion. Many of these drugs might potentially move your blood pressure up, so you become high blood pressure. Now, if you have long-term high blood pressure, meaning that you have a lot of plaques, for example, all over the blood vessels, your high blood pressure will damage your arteries and also increase that blood pressure and also eventually increase your cardiovascular risk, okay? So your heart become really a major issue because your heart muscles are all plaques that and your blood pressure is going to be high, and over time all the artery becomes so narrow, where there's hardly any space for you to move. Look at this, eventually this is your heart, and all these are plugged here, so your blood pressure is going to go up. All these might tend to lead you on heart disease, stroke, kidney disease, and other major health problems. So really, blood pressure is a very important thing that you gotta fix, okay? And some of the sign of a high blood pressure emerges, like, for example, suddenly just fainted, you don't respond anymore. You feel dizzy, you have chest pain, you have hard time breathing, you have severe headache, shortness of breath, you have maybe without a seizure, you might confuse, anxiety, vision problem, nausea, vomit. Now, all that, you need to go to hospital, not to just go to the doctor. You can't wait. You're supposed to get fixed right away. Because you don't get medical attention, you might end up with potential stroke, heart attack. You might actually die because of that. So you got to have emergency number on your purse or ever. If you're a high blood pressure person, you have all these symptoms, you need to call to go to hospital and make sure that you know where a medical facility can really treat you quick, okay? So now we'll learn about apnea, we'll learn about high blood pressure. Why there's a link? What is the issue here? What is the link between sleep apnea and hypertension? And which is very important you have to know. Now, first of all, in sleep apnea and high blood pressure, usually sleep apnea is OSA, obstructive sleep apnea. Remember our tongue, your fat neck, you tend to be so relaxed, the tongue start dropping on the airway and obstruct the airway. So you have a little air going to the airway. So your heart will come faster, blood pressure goes up. So that is the typical and very common sleep apnea. Now, statistically, 4 to 7% of general population has this obstructive sleep apnea. That is a high population, 4 to 7%. And 30 to 40% of these people have hypertension. Approximately 50% of the individual who has OSA are usually a high blood pressure individual. So it is a big percentage. If you have high blood pressure, most likely you also have sleep apnea. If you fix the sleep apnea, you know what's going to happen? Your blood pressure will be improved. That's how easy that is. That's why sleep apnea, if you can able to fix this, which you will be able to actually decrease all that potential risk of stroke, heart attack, and so forth. So important sleep apnea can be a very important thing to be fixed to prevent your high blood pressure and also better to your health. And that is why this lecture is so important for you to better understand so you can start acting on it. And don't wait, because if you wait, you might have problems that you don't know. As time goes on, your blood pressure goes up, you might have obstructed sleep apnea and can cause stroke and so forth. So don't wait. Now, sleep apnea blood pressure is now basically, I mentioned the blood pressure typically they're 10%, 20%. If you sleep, basically, if you're a healthy person, if you're asleep and healthy person, most likely you're totally relaxed. You know what? Your blood pressure will drop 10 to 20% at nighttime. However, if you are obstructed sleep apnea, your blood pressure doesn't drop. It just go up. It don't dip and improve. Then because our blood pressure is high, because you can't breathe, your blood pressure will go up. Your heart pump faster. So end result, if you continue like this all the time, you have a cardiovascular issue for you, okay? So many OSA patients do experience one, they significantly increase the blood pressure when they wake up. And also, what a lot of people call this the morning surge. And if you continue to have this a long time, your heart attack or heart cardiovascular disease risks are continue elevated. During the daytime, your blood pressure level also increase because of the severe sleep apnea. So in other words, sleep apnea is highly really related to your blood pressure, okay? So if you can able to control your sleep apnea, you know what? Your blood pressure will go down. And believe me, because I saw a lot of my patients right now who fixed the apnea. They used to be 150, 160, but because the apnea fixed, they went back to 130 and below. Wow, isn't that great? So very important to have sleep apnea to help you control better blood pressure. And so, and in the morning, you don't have the good morning surge of high blood PP. At nighttime, because your sleep apnea was well controlled, you don't get the high elevated BP while you're sleeping, okay? Now, certainly if you have sleep apnea and you didn't fix it, it deprives seriously, you actually create yourself a potential heart issue, especially your OSA. It does, what happens is when you have that sleep apnea OSA, it triggers the sympathetic nervous system which also lead to high blood pressure. Because what happened is, don't forget, when your tongue cover the obstruction, right, or your airway coming in, your heart will try to compensate, say, hey, I can't get air, so I will pump faster to get oxygen to the whole body. And with that, they also increase your blood pressure because of the fact that I gotta pump faster, I get more blood pressure go up, more blood go to all the vital organs. Very makes sense. Your pupil might be dilated. You also have higher metabolism because your whole body say, hey, I gotta get the O2 there, man. If not, I would die, right? So body will automatically respond to the lack of oxygen. So net result, you will continue activate for long-term high blood pressure. That is how simple. Because the air cannot get into your lung. They will stimulate the whole body, say, I need to pump faster, get blood to the body, but there's none, right? Because it's still obstructed. So this is how the link between the sleep apnea and blood pressure is very simple. It's all physiological. It makes sense. So the person you have OSA continue facing the airway blockage during sleep, which is now you're going to have breathing suddenly stop or briefly stop. And what happened during this time, your blood pressure keep going up. Once you somehow move, the airway drop a little bit, your air go back in, so your breathing can resume. Then you wake up again, continue to have this issue, and your blood pressure goes up. With that, you also have your sleeping being disrupted. Your body continues stress, and the stress hormone is coming up. Like you have hormone catecholamine, which is like dopamine and adrenaline in the bloodstream. You stimulate everything, the body, to make sure that you make sure that your body will move, pump faster your heart, make sure your body get more blood to go to the body to get all to the brain, to the major organ. With that, if you continue to do that, your blood pressure will continue to be high, continue to strain your heart. And then that result, you might have eventually have, if you don't take care of it, eventually you stress over the heart, you've got a heart disease, and then you also potentially stroke. And that's why it's so important really to fix your sleep apnea. If not, you really have a silent killer you don't know. Now, obstructive sleep apnea, which is also other thing will occur because one you call high blood pressure. Also, most likely you will be obese people because why? The neck here is very chubby, your tongue dropped down, you most likely have very narrow airway. So net result, you will also have high, because you're obese in this area, you will have hypertension. Plus, you're obese, most likely you have insulin resistance, which become a very complex issue. Most likely, many of these people, because they're overweight, the BMI is usually at 30 and higher, and they always have type 2 diabetic. So they become one that insulin resistant, and also if they're insulin resistant, they don't have enough insulin to take the sugar into the cell, so the blood sugar continue to go up. Usually because your obesity, you also, besides able to develop sleep apnea, you also develop high blood pressure, and then you also usually excess weight. All these conditions are all negative impact to your heart and maybe also potential to a stroke. So obesity are highly related to sleep apnea. And on top of that, because of obesity, you have high insulin resistance. So really, that result, you might actually end up with type 2 diabetes and so forth. Now, this is a complicated chart, which I'm not going to go into in detail, but remember, if you're obesity and type 2 diabetes, you are very likely have this physiological problem that you're overweight, you're insulin resistant, your body will not able to handle the insulin because the insulin resistance, so more insulin come out, it doesn't work. So eventually not much sugar go to the cells, and you lead to end up your blood sugar continue to be high, and your type 2 diabetes will get worse and worse and worse. So this is how it goes. So really, at the end of the day, that's why it's so important. If you have sleep apnea, you really have to fix it, because that will lower your blood pressure, and also because our blood pressure low, it might, your weight will be, if you can improve your weight, as also your blood sugar can also go down. All that will be all related. So very important. You need to fix that. Now, if you have sleep apnea, how do I know you have sleep apnea? So usually you have to go through a sleep study test. And what they do is they connected your body with all kinds of equipment, including your heart, lung, and brain activities. So your sleep test, you got to have all these wire in your brain to monitor your breathing pattern, your brain activities, leg movement. Some people kick the leg. And they also measure your blood oxygen level while you sleep. Now, if you're blocked, you know what? Your blood sugar, O2 is going down. So you no longer with O2 with like 95 above, you're going to O2 set will lower than 90 even, okay? And when you go to 90, your blood pressure goes up. All those things will start measure. And usually now, it's the good thing is before you have to go to hospital to do a sleep test, now a lot of the clinic, now they have what they call a home sleep test, which focus on your heart rate, blood oxygen level, airflow, breathing pattern. All that can be tracked on a computer. So to do that now, you don't have to go to a hospital to do that. You can actually now, a lot of these are doing at home. So it's really good. And the treatment is that, one, if you have sleep apnea, basically you have to really maintain good, healthy diet. You have to maintain a good sleep pattern. You don't have to drink a lot of alcohol, where you limit the alcohol consumption. You have to do regular exercise. You don't smoke anymore. You manage your stress. You also need to have a CPAP machine. If you don't have that yet, you can sit on the side so you don't have a problem of, your tongue drop down to your air pipe, blocking air. And also you have to maintain a very healthy weight, because if you lower your weight, your BMI no longer is 30, you can lower to maybe 23. Most likely your sleep apnea was tremendously improved. On top of that, because you lowered more than 10% of your weight, your A1C will definitely also increase. It will be -1 point. So again, even you're diabetic, you are tremendous improve of your situation. Now, what does CPAP machine do then? A lot of people say, I have a CPAP machine to help me. Now, what it does is, this is the most common treatment for the sleep apnea. What it uses a machine to deliver constant flow of air going through a mask or through a nose, so you always can get air. And this gentle stream of air to go to your airway prevents you the blockage and pause you from, stopping breathing. And so your whole breathing will not be disrupted. Now, the CPAP, where people now, have very common, really actually can improve your sleep apnea, all the symptoms. Also, it decreases your daytime blood pressure, okay, at nighttime blood pressure also. In other words, really get air into your system, so you don't get, tired during the day, you have a good night's sleep, and you will have decreased the chance of your stroke. All that will be improved, okay? So really important is you got to go to get a sleep test to make sure that you got a CPAP machine to help you manage the condition effectively. Now, certainly this have to go through a doctor to give you recommendation what to do. On top of that, if you are continue to have high blood pressure, certainly you have to treat it with medication, right? That is important. But believe me, really, if you have apnea, your blood pressure will definitely improve tremendously. You cannot continue to have 140 and 150. If you're apnea treated, your blood pressure will go down to 130 and below, 125 or 120. This is a significant improvement. So how low shuti can help you? First of all, low shuti can help you lower your not only blood sugar, but there's one important thing is lower your LDL cholesterol. When you lower your LDL cholesterol, then blood sugar together would not become a lot of blood sugar, and then your blood not become thick and form clots everywhere, plaques everywhere in the vessel. So net result on top of that, because they also dump out your LDL cholesterol, dump out salt and sugar through urine. So net result, your blood sugar will also come down. I mean, the blood pressure will also come down because they would dump out the salt. So they dump out sugar, cholesterol, and salt. And when the salt comes out from urine, your blood pressure comes down. So you lower your three high. That's why low sugar tea is really being helpful. It helps you also prevent you become a pre-diabetic conversion to be a diabetes. It also lower much of your diabetic potential health risks, which is like your heart blockage, your eyes, and your kidney disease and so forth. You don't want to get yourself from a pre-diabetic to be a diabetes. Or if you have diabetes already, it brings back blood sugar, A1C back to like below 6.4. So net result, many of the diabetic complications are substantially improved. So we lower your blood sugar, lower your blood pressure, and lower your bad cholesterol. That is what low sugar can do for you. And that is wonderful. So in conclusion, majority of people will have obstructive sleep apnea, which is involved the airway, which is your tongue, relax, collapse, and stuck onto your air pipe, so air doesn't go in. Net result, you actually, because the air cannot go in, your body will start feeling stressed, so the heart will pump more, and then your blood pressure will go up. So it does link with high blood pressure because of that. Now, the central sleep apnea is where disrupted the communication of the brain, telling the blood vessel to say you have to breathe. So, which is a less of common, but there is that there is this situation of central sleep apnea. Also, there are some people who have there are about majority of people OSA because they are about 4 to 7% general population of that. And 30 to 40% will have hypertension. So is a high percentage, 40, 50% hypertension. Now, if your blood pressure, if you're a normal person, your blood pressure usually dip 10 to 20% if you're normal. But if you are not, you're OSA, usually that will stop. They don't dip, they go up because the body will try to compensate. I can't get air. So the heart will pump more, also increase the blood pressure. So that's what happened. Now, also because of that, you continue to get high blood pressure at nighttime, high blood pressure during daytime. So it stress your heart, and that result, you actually become a chance of increase the risk of cardiovascular disease and also stroke. Okay. So, and also one of the symptoms of many people who have OSA, usually they're obese. They have fat neck. The neck is big here, and they snore very loud. And so most likely you can already tell these people will really need to help to lower using the CPAP machine. They have to change the lifestyle. So in that result, they can able to not to get into hypertension, and they have lower weight, so obesity will substantially decrease. Net result, they also improve the insulin resistance, because if they're not, they'll continue to be obese, the insulin should be high, and net result, the blood pressure high, everything is high. So really end up, it'll be more difficult to manage, which you need to have really a lot of people now using a CPAP, a breathing machine, continue to flow air to your airway, so you don't block the airway, and you can breathe normally. You will feel good about it because you now don't have the problem of sleeping where the airway is blocked, and that result, the daytime you feel more alert, more energetic, instead of getting very sleepy. Your blood pressure will continue to increase. Not instead increase, your blood pressure will decrease. Your insulin resistance also will be less. So the CPAP machine can be very useful for you. And really, at the end of the day, the CPAP machine actually prevent you from potentially heart attack and also stroke. So address sleep apnea definitely can help you to prevent potential stroke and heart disease, improve your cardiovascular health, and overall well-being. It's worthwhile to look into it. And if you think that your wife say, hey, you snore so loud, that is the first symptom of you potential sleep apnea. And then when you look at your blood pressure, also goes up. And a lot of people, many of these people also have high LDL cholesterol. So all these symptoms tend to lead you to understand sleep apnea, hypertension is really can be a very risky risk for your heart and stroke. So I hope today's lecture will help you better understand what is apnea, how that relates to hypertension. I hope that you start acting and find out, do you have sleep apnea? Go find out from your doctor. This is Andrew speaking. I hope that I have given you some very good understanding. If you have any question, do write to me, Andy, A-N-D-Y, at wahfong.com, WAHFONG.com, ANDY at WAHFONG.com. Phone number, you can WhatsApp me if you are in anywhere in the world. Can WhatsApp me to 773. WhatsApp me at 852-3001-5644, 852-3001-5644, or 852-6792-8891. So do write to me, because a lot of people do write to me. I answer them, and I hope that we can give you an idea and you can get yourself understand where to go from there. So it's good to communicate. So I'm really hope that today's lecture can help you to better understand what is sleep apnea all about, and also teach you, help you understand how to prevent sleep apnea and what's the relationship with the sleep apnea and hypertension. Importantly is if you felt that I have not slept well, I snore very loud, go get a sleep test and find out do you have sleep apnea. Okay, hope you all have a very wonderful weekend. I hope things will be better for you, and looking forward to talk to you next week. Take care. Thank you.